is Brooke Burke. Welcome to Therapy with the Stars. Tonight, we will be exploring the pain in which teen star Demi Lovato has struggled through, and how her diagnosis has affected her.
Hi Demi, how are you doing today?
I'm doing so great. I stayed up all night and I wrote 7 songs. Isn't that great?
Wow, that is great. Is that typical of you?
No, not really. Last week, I was at such a low point in my life. I became so down, I even inflicted pain upon myself.
Wow. Have you experienced any other depressive behaviors?
Unfortunately, I have. Recently, I felt very fatigued, and I was even sleeping up to 12 hours a night. I never wanted to get out of bed. I felt so worthless, and it felt like my life had no point.
Oh, you mentioned that you had been hurting yourself. Can you explain that?
Yes, I've been cutting myself, and I've even struggled with eating disorders recently.
Demi, why did you not seek help earlier? So many people care about you. I'm sure your family is worried. Have they expressed any concern for you?
At first, I wasn't sure what I was going through. I felt scared and confused to why I was feeling this way about myself. I felt unfair to my friends because I was experiencing such drastic mood swings.
How have your friends reacted to this?
Since I spend the most time with them on set, they've noticed that I get really upset about small things and then tend to isolate myself. Then the next days I'll be like really hyperactive and talkative.
And how often do you experience these mood swings?
At least 3 times a week.
Oh. So you seem to be a rapid cycle between the mania and the depression. So do you agree right now that you're in a state of mania?
Yeah, I guess so.
Okay, can you describe yourself and what you experience during mania?
I'm always like opposite of what I usually am. I run on little to no sleep, and I always socialize with other people. And recently, I've always been like ready to do things, really hyperactive. I'm just happy, and I wish I could always stay this way.
Well, it looks like your diagnosis of bipolar disorder is accurate. You experience mood changes on a rapid cycle, which means several times a week, and possibly daily.
Bipolar disorder affects 10 million people in the world. It is important for patients to receive proper care. The most common therapy is cognitive behavioral, but we will also see Demi receiving drug therapy.
Okay, so Demi, to start your treatment, we will begin with cognitive behavioral therapy, and it will help with your disordered thoughts and interpretations that influence your feelings. They lead to problematic emotions and moods, and the cognitive behavioral therapy will help in your recovery from episodes, daily relapse, and improve your overall functioning. And the goal of this therapy is to realize that when you are entering your negative state and try to use mindfulness to bring yourself out of that.
So I need to try to create distance between my negative thoughts and the actual situation?
Exactly. We will practice cognitive reconstructioning, which means you will be reevaluating negative thinking patterns. For example, like if you had a job and one of your bosses said that they wanted to meet with you, you would usually probably think, oh my gosh, like he's going to fire me, I must have done something wrong. But you can't think like that, you can't think so negatively, you just need to think that he might want to discuss ideas with you or something new.
So like when my boyfriend asks me to go and talk to him somewhere, I shouldn't just assume that he's going to break up with me. I should think that maybe he just wants to talk about like my weekend plans.
Yes, that's exactly what you need to do. Taking these small steps will help you in your overall therapy.
Okay, I think I can do this.
Okay, so Demi, your second therapy approach is drug therapy. Medication can bring mania and depression under control and prevent relapse once your mood has stabilized. You may not like the idea of taking bipolar disorder drugs for like long term, especially if you're struggling with some of the mild side effects that they have. But just as a diabetic needs to take insulin in order to stay healthy, taking medication for bipolar disorder will help you maintain a stable mood.
So what medications do you suggest?
Well, we're going to avoid antidepressants, and the treatment for bipolar disorder is different than a regular depression. And in fact, antidepressants can actually make bipolar disorder worse or trigger a manic episode. And some mood stabilizers are medications that can help control the highs and lows of bipolar disorder. Okay, they're the ideal form of treatment, both for mania and depression. Lithium is the oldest and most well-known mood stabilizer.
Okay, and does lithium have any side effects?
Unfortunately, yes, but you're going to find side effects in any drug that you take, but some of the side effects are drowsiness, fatigue, nausea, and vertigo. However, it's still important to get blood tests every 2 to 3 months, since many things can cause your lithium levels to change. Also, lithium takes from 1 to 2 weeks to reach its full effect.
Now let's visit Demi 6 months later and see what progress she's made.
Hey Selena, how's it going?
Hi, Demi. I'm good. How are you?
I'm doing great. Are you excited for the movies tonight?
I am, but I'm so sorry, but I don't think I'm going to be able to go. Justin just called me and said that he made dinner reservations for us tonight, and I really don't want to cancel on him. I'm so sorry.
Alright, it's okay.
Let's go another time, though, okay?
Okay, it sounds good. Bye, Selena. I just have to remember what my therapist told me, that she's still one of my friends. She's not canceling on me because I'm worthless. She's canceling on me because she has other plans, and I'm sure we'll still hang out another time.
So Demi, it's been 6 months since your diagnosis. We can obviously see that you have improved by handling that situation so well. How have you seen your moods change?
Well, I've actually learned how to control my moods when I'm getting negative, and I've noticed that the lithium has helped in stabilizing them too.
And even though we have seen your mood stabilize, it's important for you to continue to take the lithium, because ending the medication could make you relapse into your old, more severe mood swings.
I plan to stay on my medication and stay strong.
So Dr. Coleman, how easy was it for you to diagnose Demi?
She followed the behavior patterns that most bipolar patients go through. With mania, she was experiencing euphoric feelings and feeling very social. And her moods changed drastically to depression, where she was physically and mentally slow.
Will her medication treat all symptoms of bipolar disorder?
No, it also takes a lot of mental training to reverse her thinking patterns and mood swings.
What can other people experiencing these symptoms do?
I encourage them to go seek help and talk to a psychiatrist. Bipolar disorder affects 2 million people in the U.S. and it is widely underdiagnosed. You are at a greater risk if you have family history of mood disorders.
If you or anyone you know is struggling with drastic mood change, do not be afraid to seek help. Join us next week on Therapy with the Stars as we explore Zac Efron's struggle with schizophrenia.